You're watching Health Matters. I'm Renee Rouse. Thanks for joining us. Our mission with this show is to give you important information that affects the health and safety of you and your family. In every edition of Health Matters, we cover the big health and safety stories on the Treasure Coast. In a segment we call Health Spotlight, we'll go out in our community and feature people and businesses making a difference and making the Treasure Coast a healthier place. And lastly, in our health calendar, we'll hear from people and learn about health-related events in our community. Here's the rundown for this edition of Health Matters. First, protecting the uninsured members of our community is a worthy and important cause. We'll introduce you to a national nonprofit dedicated to building a network of sustainable, free primary health care clinics for the uninsured here on the Treasure Coast. We'll speak with Mary Fields, Executive Director of the Volunteers in Medicine Clinic located in Stuart. In Health Spotlight, we'll explain why hundreds of local students are smiling brighter. Carlette Peck, Health Officer for the Florida Department of Health in Martin County, will also tell us about the lessons we can all learn from this healthy initiative. And in Health Calendar, we'll update you on flu season here in South Florida. We've got the information you need to know to keep you and your family safe. According to the Health Care for Florida Now, more than 22,000 people in Martin County do not have health insurance. More than 7,000 of them are in the coverage gap because Florida did not expand Medicaid. It's a big problem with a complicated solution. One group helping the uninsured is Volunteers in Medicine, VIM for short. They are developing a network of free clinics across the country. Some are right here on the Treasure Coast. Whenever possible, they try to use retired medical and community volunteers. VIM started in Hilton Head, South Carolina. In the early 1990s, 1 out of 3 people who lived on Hilton Head Island had no access to health care, a rate twice the national average. Now, there are nearly 100 clinics in the VIM Alliance. Joining us now in the Health Matters studio is Mary Fields. Mary is the Executive Director of the Volunteers in Medicine Clinic located in Stuart. Can you provide us with an overview of your services?
Yes. Volunteers in Medicine Clinic is a primary care medical facility located in Stuart. We've been in business for 20 years now. The idea is to use volunteer medical and clerical professionals and provide quality medical care to those who don't have access to it. Our staff include physicians, nurse practitioners, physician assistants, nurses, medical assistants, and clerical personnel. We also have a small paid staff of nurse practitioners, some MAs, and clerical.
It's amazing, 20 years of service in Martin County, and you know, there's still some folks who aren't aware. What are uninsured in Martin County? There is still significant numbers there.
Yes.
What are some of the services that you're actually able to provide?
In addition to primary care, we have a lot of specialty care. It's really whatever the volunteer provider can give us is what we can offer. So currently we can offer gynecology, gastroenterology, urology, podiatry, ophthalmology, optometry.
That's pretty extensive. Yeah. That is very extensive. What are some of the eligibility requirements? What would people need to know if they were maybe thinking, you know, could I be eligible for this, and how would they find out more?
We have an awesome website. It's vimclinic.net, so our eligibility requirements are on there. But you can also call the clinic at 772-463-4128 and speak with someone who can go over the requirements. And basically, you have to live in Martin County, be an adult, not have private health insurance, not have Medicaid or Medicare, and be within a certain financial group. About $23,000 for one person, a family of 4, almost $48,000. And if they meet that criteria, what they would do is schedule an appointment for an eligibility screening, bring some information. If they qualify, then we make an appointment with the provider. And when they're assigned that provider, that is their physician or nurse practitioner or PA for the entire time when they're at their clinic. It's really like a regular doctor's office. It's just that it's at no charge to the patient.
I actually had the opportunity to come out to VIM and see the clinic in action, and I met some wonderful volunteers. You have a very large volunteer base.
Yes.
Can you tell us a little bit more about the volunteers and maybe give some specifics on, you know, some particular ones that really stand out?
I think a lot of the practitioners volunteer for many reasons. One, they've been fortunate that they actually have time in their lives now that they can give back. But also I think when you retire, they've been practicing medicine for so long, to just sit on the beach or play tennis a few times a week isn't enough. And since there is such a need, I think that's why they volunteer. And I remember when we started with 3 doctors, and now we have 31. It's a great environment. I think that they feel that they can practice without pressure. They can spend as much time with the patient as they want. And I think they see that they do make a difference.
Excellent. Well, we certainly enjoyed learning more about the program. And for more information, you can turn to
VIMclinic.net.
VIMclinic.net. Thanks,
you.
Mary.
Thanks, Renee.
We're turning now to what we call Health Spotlight. In this segment, we go out into our community to feature people and businesses making the Treasure Coast a healthier place. Hundreds of local students are smiling brighter because of a dental sealant program in our schools. The pilot program, launched near the end of 2014, has provided close to 600 students in need with dental sealants. For more on this issue, we have Carlette Peck joining us. Carlette is the health officer for the Florida Department of Health in Martin County. Hi, Carlette.
Hi.
Thanks so much for joining me. Dental sealant program, very exciting new initiative in the schools. Can you give us an overview?
I sure can. I really appreciate the opportunity to talk about this program. This is a pilot program. This is the first year that we have offered these services in the Martin County school system. And the services include an assessment done by a dental hygienist, dental sealants placed on the surfaces of the molars of children, and then we provide dental hygiene counseling as well, and the kids leave with a little kit. This is done right now in the Title I schools, but we would like to expand it to offer this program to all school children in Martin County and even in the daycares.
Well, one thing I wanted to mention too that's very important, this is done with parental consent.
Oh, absolutely.
So parents receive a letter through the schools letting them know about the program, and they have the opportunity to opt in or not.
Correct. A lot of children do have access to and may even have sealants in these age groups. We're doing 2nd, 3rd, and 5th grade. So they may already have a dentist, but there are a significant number of people, children in particular, who do not have access to a dentist. Perhaps their family, they don't qualify for Medicaid assistance, yet they don't have dental insurance either. And that's really a group that's falling through the cracks. So that we are kind of aiming for the Medicaid children and those that do not have access to either dental insurance or to dental services, because they're costly. Many families have to choose between feeding their family and dental services. So what it does is it seals the molars, the surface of the molars, so that decay doesn't begin to happen.
And it's a very portable program, as you mentioned.
Correct.
School to school. The dental hygienist has a Porta-Pack, and she's actually able to go out. Can you walk us through that, what it actually looks like?
She has a portable chair, and she has a portable compressor, because you need to dry the teeth off before you put the sealants on, so the surface has to be dry. What she does is she works with the schools around their schedule, and she can set up anywhere in the school, and regularly does in very odd places sometimes. She has a van that helps her move the equipment, which is portable, as you said. And then the children and their permission slips are sent one by one to her for her to educate them, do an assessment, and apply the sealants if necessary. Some of the parents, you know, their children already have sealants, but she will re-inspect, and if they need to be referred back, if they're chipped, or which often happens, then she can at least refer them back or repair it, whichever. The beauty of this is that the children do not have to be taken out of school to have the sealants applied. Takes about 15 minutes from the assessment in the beginning through the child going back to class with their little toolkit, which has a toothbrush, dental floss, timer, so they're brushing their teeth, and of course toothpaste. And some of these children do not even have toothpaste.
I think it's also important to mention, for those who may not be familiar, oral health is really important to overall health. What goes on in our mouths really does affect our overall health. So you could probably share a little bit of information about that, maybe about some of the things that our dental hygienist is actually seeing in the schools right now.
Right, 15% of the children that she has examined have urgent dental issues. That would be draining abscesses, teeth that are decayed beyond recognition, and about 22% she finds active cavities in these children. Another survey in the Head Start program, anywhere from 30 to 58% of the children had some sort of dental disease. So we would like to work in that group as well with Head Start.
Funding, of course, is always an issue. And you did say this is a pilot program, so there's really no guarantee that it will continue.
Correct.
But how are we hoping, or what are we looking for as far as sources for funding?
Well, we're working with the community. We have introduced the subject to the Children's Services Council, and we'll be, trying to develop a partnership. We are in the process of starting the conversation about how to keep this going because we feel it's such a good program. The other thing, children with dental decay, it really also has a secondary impact on literacy. Dental pain is a leading cause of absenteeism from school. Children who are absent can't learn how to read, and that's exactly the age group that the molars need to be sealed, which is, second and third grade. They spend a lot of time in those two grades teaching children how to read. So it has not only physical implications, but also long-term in terms of intellectual achievement and educational achievement.
Excellent. Such an important initiative. We're so happy it's happening, and we're hoping that it will be able to continue. Thanks so much for joining me.
No, thank you.
Now it's time to check in on the flu season in your health calendar. You may be familiar with the symptoms: sore throat, coughing, congestion, fever, achy feeling all over. It's called the flu, and flu season continues here in South Florida. It's best to be prepared and take steps to prevent getting the virus. Influenza is a highly contagious respiratory illness that can cause mild to severe illness. Young children, those with compromised immune systems, and chronic health issues such as asthma and heart disease, as well as older folks, are at higher risk for serious flu complications. One of the best ways to prevent the flu is to get the flu vaccine yearly. Recently, I had the opportunity to meet with Mrs. Rasmussen's second grade students at Port Salerno Elementary. The students were very eager to show me their work and research related to the flu virus, and were very knowledgeable about the ways to prevent the flu. They are certainly doing their part to shoo the flu. Here's a recap of what we covered in this edition of Health Matters. First, protecting the uninsured members of our community is a worthy and important cause. We introduced you to the only national nonprofit dedicated to building a network of free primary health care clinics for the uninsured here on the Treasure Coast. We spoke with Mary Fields, Executive Director of Volunteers in Medicine Clinic, located in Stewart, where they try to use retired medical professionals to help the uninsured. In Health Spotlight, we explained why hundreds of local students are smiling brighter with a new dental sealant program. Carlette Peck, Health Officer for the Florida Department of Health in Martin County, told us about the lessons we can all learn from this healthy initiative. And in Health Calendar, we updated you on flu season here in South Florida. But there's one more important and timely thing we wanted to add. Prevention and early detection are important keys to good health. And now, help is available for women in need of screenings for breast and cervical cancer. This free program, coordinated by the Florida Department of Health, is specifically for women who live in Broward, Palm Beach, or Martin counties. Participating women must be at least 50 years old with little or no health insurance. To learn more, you can call 954-762-3649. That number is 954-762-3649. That's all for this edition of Health Matters. I'm Renee Rouse with the Florida Department of Health in Martin County, where it's our mission to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. Thanks for watching, and remember, health matters.